All right, so this is patient 1. We have a 59-year-old that presents in the clinic with chest congestion and a cough for 2 weeks. They do notice heart palpitations for a week on and off with a quote-unquote sudden aware of their heart beating really quick. History is going to be hypertension. Medications they take are Deliverable 10 milligrams once a day for hypertension, along with over-the-counter cold meds for a week. The cold meds do contain a decongestant. Vitals look okay. No fever. Temperature is 98.1. Oxygen 95% on room air. Respirations are 22. And heart is 83. And vitals, blood pressure is 148 over 92. So my name is Victoria. I'm going to be your nurse for today. Hello.
Hello.
So I was kind of reading in your chart and I saw that you were complaining of chest congestion and a cough for 2 weeks. Is that correct?
Correct.
And for about the past week, you've noticed on and off a sudden urge and awareness of a fast heartbeat. Is that correct as well?
Yes.
Okay. Your vitals look good. I see you only take lisinopril once a day for high blood pressure. And I do see that you are taking at home over-the-counter cold meds. Is that correct?
Correct.
Okay. And like I said, your vitals look fine. Your blood pressure is a little elevated, 148 over 92. Your respirations are 22. And you are at 95% oxygen. So nothing too concerning, but still a little elevated. So we're going to do 2 assessments today. If you're in any pain, just let me know. I'm going to walk you through everything. If you have any questions, let me know as well. I can do a better explanation of what we're doing. So we're going to do 2 assessments. The first is going to be respiratory, and the second one is going to be cardiac. We're doing the respiratory assessment first because you are complaining of a cough for 2 weeks. Your respirations are a little bit elevated. You are sitting at 95% on oxygen, and you are complaining of chest congestion. This can possibly show you have some sort of pulmonary disease or like a possible sign of infection. So if that's okay with you, I'm going to go ahead and listen to your chest, your lungs, assess your breathing, and see if your lungs are congested or if there's like a decreased airflow. Is that okay with you?
Okay.
Okay. So hand hygiene, I put on new gloves. So first and foremost, I'm going to go ahead and inspect your chest. If you can just breathe normal for me. Good. Upon the introduction phase and right now, I see the chest is rising symmetrically. He's never used any type of accessory, abdominal muscles for breathing. The skin color looks good. You're perfusing fine. There's no type of cyanosis within the lips. And there's no clubbing within the fingernails, which is good that I've noticed. And sir, when you walk or do any type of physical activity, do you have any shortness of breath?
No.
No? Okay. Just the cough on and off that feels congested. Is there any phlegm that can come up? Have you been coughing up any phlegm? Or does it feel like it's deep in your lobes?
It's deep in my lungs.
So, okay. Has it affected your sleeping at all?
A little bit.
Okay. So next we're going to go ahead and palpate the chest. If that's okay, I'm just going to kind of press on your chest, look for crepitus. All right. You can stay normal. You can stay sitting up. Any pain or anything?
No.
No? Okay, good. I'm going to go ahead and assess the back. Any pain as I'm pressing?
No.
No. Okay. Good. I'm just going to rate my findings. Next, we're going to go ahead and percuss over the lung fields. We're checking for dullness, which means that it's kind of a dull sound, and we're either over a solid organ or there's some type of infection, mass within the lungs. Otherwise, we're going to hear resonance, which is a normal, like, hollow sound, air-like sound. That means the lungs are good. So I'm going to use my middle finger, my distal. You can just breathe normal. I'm just going to percuss over the lung fields. Good. Any pain with that?
No.
All right. I'm going to go ahead and write my findings. Next, I'm going to listen to your lungs. I'm going to listen to the front and to the back. So whenever I tell you to take a deep breath, please take a deep breath and we'll move on. I'm going to do the front and the back. All right, take a deep breath. In. Out. Take a deep breath in. Good. Lift your arm up for me. Take a deep breath in. Good. And the other arm lift up. Deep breath in. Good. I'm going to move to your back and I'm going to kind of go side to side just so we can compare. Take a deep breath. Deep breath. Deep breath. Deep breath. Good. Nice. Deep breath. One more and then we're done. Alright. I noticed that you didn't cough, which is good while we take the deep breaths, but did you still kind of feel tight and congested in your chest taking the deep breaths?
Yeah.
Okay. So it does sound like there's some congestion, but there's no signs of like respiratory distress or severe distress. So I'll let the provider know for our findings. And the second assessment we're going to go ahead and do is the cardiac assessment. We're doing this because you were for about a week complaining of random chest palpitations. You do have a history of high blood pressure. Your blood pressure was slightly elevated, but you are taking over-the-counter decongestant medication for the cough. That can actually increase blood pressure, and it also can cause like an abnormal heartbeat. So it's good for us for some uses, but again, there are side effects that people aren't told about. You don't read the small labels if you get it over the counter. So we'll do that, make sure nothing else is going on. I don't hear anything abnormal. So I'm going to go ahead and first and just inspect. Just look straight for me. I don't see any JVD. There's no neck swelling. There's no facial swelling. The perfusion is good. There's no cyanosis in the lips. No clubbing within the nails. No, like I said, no facial, no neck swelling. Next, I'm going to go ahead and palpate your pulses. I'm going to do 2 carotid and then 2 radial, if that's okay. Good. Good. And next is going to be your radial. Good. So those are all +2. They're normal. There's no irregularities I heard within the pulse at all, which is good. The next thing I'm going to do is auscultate over the 5 cardiac landmarks. While I'm listening, I'm going to go ahead and assess the rate, the rhythm, if there's any murmurs. I'm going to see, check for S1, S2, and then any type of irregularities. Sometimes we can hear AFib, which is an irregular heart rhythm. So you can just breathe normal. I'm going to go ahead and assess. Good. And lift up your arm. Everything sounds good. So I'll go ahead and let the provider know. I do want to give you some patient education. Again, we do take certain medications that are over the counter, but there are possible side effects that people don't know about. Like I was saying, the cold meds had like decongestant properties in them, so it can increase your pressure, and listening to your heart can help determine an irregular rhythm. So the medication could be a possibility and explain why you're having those symptoms. But again, I'll go ahead and let the provider know. Do you have any questions for me?
No, it's fine.
No? Okay.